My goal is for the patients to feel better, to get a better quality of life, to get more years out of life, and to continue to enjoy what they enjoy and being a productive member of our community. I've always wanted to be a physician. Early on, since I was in school, I've really enjoyed the sciences. That, together with my desire of helping people, it was easier for me to make that decision early on. My focus of practice relies on advanced heart failure and transplantation. It also encumbers patients who have pulmonary hypertension, and we also follow the high risk of OB/GYN patients as well. It is a very exciting time to be a cardiologist nowadays because of the advancement of medical therapy. Not only that, but the advancement of machines that help us achieve our goals is impressive, and we're able to support significantly better patients who 5 to 10 years ago didn't have a chance. With the advancement of technology and the advancement of diagnostic techniques, we were able to diagnose and help better treat these patients early on in the treatment for conditions like amyloid disease, hypertrophic cardiomyopathy, or heart sarcoidosis as well. Transplant requires a lot of help from a lot of team members. That's why we need a multidisciplinary approach for this. It requires for patients to be seen by multiple specialties, including physicians, surgeons, pharmacists, social workers, behavioral therapists, in order for us to get to know the patient in detail. It's like looking at the problem from a 360 view. I do believe that paying attention to the science behind this is very important, but the human approach needs to be there as well. They have to go side by side together. My personal approach to establish a good personal relationship with our patients is being open and honest. It's always about educating them from day one and help them understand what the disease is about and what to expect. The balance between, adequately treating that patient and providing the adequate care, and also listening to their story and what afflicts them the most. It's easy to use the typical cocktail of medications for a typical condition, but if you individualize the treatment and pay attention exactly to the patient's telling, they may have a better time with you, and they may have an easier time going through the treatment and through the process. I think it's very gratifying to be a physician, playing a role in our community and helping people out, using science to further advance quality of life. It is very rewarding seeing somebody who's been very sick and struggling with a condition for a long time and coming to see you in clinic with a smile and from ear to ear, and the energy to come on and greet everybody. I enjoy what I do. I enjoy the impact that I have on our patients. My goal is for them to be happy.